Hello, my name is Jackson Shriver. I'm a fourth-year medical student at the USD Sanford School of Medicine, and I'm here today to present my poster, Telemedicine in the Wake of COVID, a statewide demographic study on provider utilization and perspective in South Dakota primary care settings. This study was conducted with myself and classmates Dane Hegdahl, Rebecca Glanzer, and Ryan Patrick under the mentorship of Dr. Tim Ridgway in coordination with Sanford Health. As we all know, the COVID-19 pandemic has drastically affected healthcare in a variety of ways, both on inpatient and outpatient services in almost any care setting. One area that saw a unique change in the COVID-19 pandemic was utilization of telemedicine services. As social distancing and changes to CMS reimbursement for telemedicine usage occurred, telemedicine was reported to have drastically increased in usage on a nationwide level. As a rural state, South Dakota was uniquely positioned to emphasize use of telemedicine to improve access for citizens in rural communities. However, at the time of this study, no study had particularly been conducted to assess for telemedicine usage rates within South Dakota or for provider opinions within South Dakota on their opinions of telemedicine. So our team partnered with Sanford Health and conducted a two-armed study to evaluate for changes in telemedicine usage as well as provider opinions of telemedicine usage. The first component of our study was an EMR database mining project where we looked at telemedicine usage from April and June of 2019 to the same time period in 2020 at the start of the COVID-19 pandemic. We looked at telemedicine usage in a variety of specialties throughout Sanford Health facilities within the state of South Dakota. A second component was a survey distributed to primary care physicians within the Sanford Health system. Questions assessed for demographic information of providers, perceived barriers to effective usage of telemedicine, perceived benefits, and opinions regarding telemedicine both before and during the COVID-19 pandemic. There ultimately were a total of 72 respondents with a response rate of 29%. So, looking at Table 1, you can see the result of the first arm of our study. The total number of visits from April to June of 2019 was 3,633. This number drastically increased to 61,742 in the corresponding time period within 2020. This mirrored many of the national studies that had been conducted showing a drastic change in telemedicine usage. Additionally, we showed that within South Dakota, family medicine, psychiatry, internal medicine, and neurology showed the largest number of telemedicine visits. These specialties also were found on a national level to have had the largest number of visits in a typical clinical setting. Now, moving to Figure 1, regarding the opinions of telemedicines from provider. When answering the first question of before COVID-19, I considered telemedicine to be highly beneficial to my practice, only 29% of responding physicians either somewhat agreed or strongly agreed with the statement. However, we saw a drastic change when considering during the COVID-19 pandemic. At that time, 83% of providers stated that telemedicine was highly beneficial to their practice. And importantly, when considering moving forward in their clinical practice, 58% of individuals said that telemedicine would be a vital role within their practice. This shows a drastic change in telemedicine opinions following the start of the COVID-19 pandemic. Now, moving to Figure 2, you can see the types of visits that providers felt were most effective to providing care. Visit types of lab result discussions, behavioral health, follow-up visits, medication reconciliation were the most popular types of visits. These visits typically revolved more on the communication aspects in medicine and were less reliant on a physical exam. This allowed for telemedicine's video forward feedback to be more effective than visits that required a physical exam. Now, moving to Figure 3, you can see provider opinions of telemedicine. The strongest benefits of telemedicine were thought to be improving patient access, improving patient satisfaction, facilitating continuity of care, and improving provider productivity. These allow for improved patient access, especially in many of our rural communities that otherwise individuals may have to travel long distances to seek care. And finally, looking at Figure 4, when assessing barriers to telemedicine use, most common responses were appropriate technology access, IT issues, patient insurance coverage, physician reimbursement, and liability protections. It's essential that moving forward, if we want telemedicine usage to continue to grow and provide improved access for our patients, these barriers must be addressed. So finally, in conclusion, we found that in the early phases of the COVID-19 pandemic, South Dakota saw similar changes in year-over-year telemedicine usage as seen in national studies. Also importantly, we found that providers generally view telemedicine more positively after the start of the COVID-19 pandemic than before. Next, we found that telemedicine provides a unique opportunity to improve patient access in South Dakota, as many citizens are rurally isolated. And finally, if we want to have continued telemedicine usage growth within South Dakota, we must address many of the barriers that are in place, both from patient access to technology as well as reimbursement and protection for physician liability. Thank you, and I'd be open to any questions.